Welcome, everyone. This is Coffee with a Journalist, where we talk about all the things publicists need to know to make better relationships with reporters, journalists, the people in the media doing their dang jobs to help us out. Relationship building is what it takes to make this world go round in the media sector. And with us today is Lizzy Lawrence. She's the FDA reporter, just upgraded at STAT. Previously medical device reporter. So Lizzy, you must have some technical expertise up the wazoo. I'm so excited to chat with you. Welcome and thank you for being here.
Thank you so much. I'm excited.
Yes, my dad's name is Lawrence, by the way. So I don't usually see a Lawrence.
Great name.
Great name. Yes, solid. First, Lizzy, I like to ask this, even from the biggest outlets, everyone knows the outlet or whatever. Can you tell us a bit about how you would define the coverage of STAT?
Yeah, so STAT we cover health and medicine, the life sciences. We are a part of Boston Globe Media. And our readership, it's people in the life sciences industries. We have doctors, we have biotech folks, we have, patient advocates. It's really just kind of a specialty niche publication focused on health.
And how did you get now bumped into, or I'm going to say upgraded to, the FDA reporter? That's got to be a huge undertaking and one that changes constantly.
It is. It's a really fun beat. I've been doing it a couple months now. I was previously our medical devices reporter, so I covered the FDA in that realm, but I was also doing pieces more on medical device startups and more business reporting. Now I'm based in DC, and I'm really laser focused on FDA, and it's something that we at STAT, we've covered the agency on different teams, but we haven't had an FDA specific reporter in a while, and it's such an important area for our readers. So my editors and I felt that it would be a really good step up for me and serve a really important part of our coverage.
What would you say is surprising you, maybe, if anything, right now we're at the FDA? Are you like, ooh, dang, didn't see that one coming, didn't see that in the dance card? Obviously, we have a new administration coming in. Okay, there's that. But anything else, particularly this year? We're recording this in December as context.
Yeah, well, I mean, so far, and everything could change as far as policies, but we'll have to see what happens. So far, I've been really interested in what's going to happen with food regulation. I think that's something that's consistent in this administration and next administration. This is an area of the FDA that's still really being figured out and needs some work to figure out, okay, how are we actively keeping track of whether chemicals in our food are safe? How often are we checking in on that? And I went to a meeting in the fall about this and about the FDA kind of trying to bolster that effort. And so that's something that's really interesting to me. And
how'd you feel? How'd you feel about it? Were you like, oh, that gives me some confidence, or were you like,
Well, I felt that, I mean, the big caveat at that meeting and whenever I ask people about food regulation is that there's really not a lot of money in the food center, specifically the drug center at FDA. They get user fees from the companies that submit their products, as well as the device center. The food center does not have this, and they were denied funding from Congress most recently when they most recently requested it. So I feel like it's a good step. I'm not really optimistic that things will change so dramatically, but we'll see. I mean, this is something that, right, Make America Healthy Again is really focused on. So we'll see if things move the needle there. But
gosh,
yeah, a lot happening in FDA land for sure.
Oh, it's never boring for you, I'm sure. That's great. But I've never met a journalist who was bored. So
that's true.
There's that too. Okay, Lizzy, let's talk about your inbox. How is it in there?
It's not too bad.
Okay.
I think,
how refreshing.
Yeah, I think that the nature of my beat and STAT being a little bit more niche, it's I mean, I get a lot of emails, but a lot of it is newsletters. I've subscribed to.
Yeah.
As far as pitches, I think it's like 15 to 20 pitches a day. It's not overwhelming.
Lizzy, that's like
so
probably a record on here. Oh my gosh. So, okay. So if you get 15, 20 pitches, which sounds very manageable, what are you doing with them? Do you you open every one? Do you do the mass delete? What do you do?
I do not open every one. I open them very rarely. And yeah, a lot of them are not really relevant. And it's hard right now because I don't think everyone knows that I've changed beats. So I'm still getting a lot of medical device pitches.
By the way, medical siren going by. There you go.
I know. Sorry if that was very.
No, we're all in our home environment with clanking and things and all the things. Yeah.
But yeah, I would say I read very few of them.
Okay. You did tell me, though, before we got on here, that you have some pulled that you wanted to share. Was that my understanding?
Yeah.
Do tell. I love when people have their homework ready.
Yeah. So I have some that I've starred that I've actually found to be very helpful pitches.
Okay.
So
yes.
Yeah. One is animal law expert on federal and Trump administration response to bird flu outbreak.
Oh, okay.
So I felt
what do you like about it? I'm like, I already know some juicy pieces, but go ahead, tell me.
Yeah. So, I mean, it tells me immediately what is in that email. And it's not like I'm writing a story on this right now. However, I'm sure bird flu and whatever the Trump administration's policies are going to be around bird flu is something that's very much on my radar. So I started this email immediately because I was like, okay, this is someone I can go to if I need an expert source in that area. So it was just very clear and easy to read.
Okay. Boom. Right there in the subject line. Okay. Good job, publicists. What else do you have?
I mean, another one is kind of similar vein. Future of drug regulation from Columbia University bioethicist POV. Same thing. Okay, here's a person that I can go to if I am doing some sort of forward looking trend story on what's going to happen with the FDA. I thought that was very useful. And then I would say that something I found, I also get a lot of pitches that are a little bit more wonky in the subject line. And I think that, sorry, there's quite a few sirens outside right now. Something is going down in DC. I get a lot of emails about data drops from companies. This one was embargoed SABCS data from Agendia -genomic tests. And it's just, that's a harder subject line for me because I'm not familiar with the company.
Yeah.
I don't really know. There's so many acronyms in this world and I don't know what that is. Like, I think obviously I know a lot as a reporter, but I can't remember every company. And I think sometimes I get pitches where I'm like, this just doesn't, I don't know why this is important and why I should write about this. And it's hard to fit that into a subject line for sure. But yeah, those are the ones that are a bit more challenging.
Got you. Now you said you don't read most of them. So what do you do with the ones you don't read? Do you just trash them? Do you just never see them again? Or you just let it ride?
I never trash. I feel I'm too sentimental.
Me neither. Truly in mine, I'm just like, no, read. Okay, great.
Yeah, exactly. Yeah. I just mark as read. Like, it's good to have in there, I think. It takes a lot for me to actually delete an email. Like, I have to be like, all right, I just don't even want this.
Good. Easy.
To be around.
Okay. Yeah. Gotcha. Then what for you, if any, is a great pitch you want, let's say right now? You want to hear about X.
I would say broadly, like the ones that I shared.
Yep.
I like pitches for expert sources,
Yep.
and especially like regulatory lawyers, and like I can never. It's always useful to get that, even if I don't need it at that moment in time. I've often gone back and saved those emails for later. For right now, I mean, we're getting to the end of the year. I have a few stories I'm wrapping up that I have enough sourcing for, but you know, I'm sure I've started to get these pitches, and I don't want to get an influx of them, but it is helpful to get I'm going to be doing a what to care about as far as FDA next year, or what are going to be the top items, you know, like many publications having this kind of forward looking story in each of our areas of coverage. That's coming up. That'll be something I'm working on next week. So
good. Yeah. Are you getting any that you're like, oh my God, like the look back of review or this or that, where you're like, ugh, you know, anything like that?
Yeah, I am. Yeah. I did. Okay, one more I wanted to share because it kind of made me chuckle is I got 4 emails offering plumbing industry resource stories about innovative pipe fitting products.
No.
And I just like kept marking them as read. Like they kind of made me laugh. And then I got an email asking if I was the right media contact. And then I finally was like, I am not. And I've stopped getting
Okay, good. Okay. So at least you saw that, you got a laugh, you then responded not. Okay. Do you do that often at all though? Just respond back and be like, listen, I'm just not. Please don't send me. This is the 7th time.
It has to get to a fever pitch, or like in this case, the person directly asked me. Yeah. And I was like, great, here's an opportunity to say stop. But yeah, I usually don't respond unless it becomes like unmanageable.
Got it. Okay. That's fair enough. Good. Lizzy, what we talked about, like, you know, who you're looking for. Do you have any pet peeves that are just driving you bonkers with publicists? Do tell.
Something that I find annoying is if you send separate pitches to me and then multiple of my colleagues. I feel like, I'm sure this has come up before, but it just makes things harder for us because, you know, yeah, it's just confusing if both of us want to take it, if, you know, not one of us felt it was a story, the other one didn't. It's just like, it can lead to some miscommunications. So if you're not sure who the right person is, I would be upfront about that and maybe send it to all of us. Send it to one of us and say, if you're not the right person, can you tell me who I should send this to? Which a lot of people have been asking me that recently because I'm not doing medical devices as much, though I still want to write. I'm writing about them, and you know, as far as the FDA, people are asking me which of my colleagues to go to, and I'm happy to respond.
But is that a little lazy? Are you okay with that because it's not clear?
I'm okay with that.
Okay, that's
because I feel like with stat, it's not super clear. Like we have a lot. It's a really collaborative newsroom, and so sometimes people are writing different things. Obviously, like sending me plumbing pitches and asking if I'm the right contact is lazy. Like clearly, I've never written about plumbing.
Yeah.
But yeah, I think there's like a spectrum. You know, sometimes it's like, okay, it's pretty obvious that I don't write about this, and other times, you know, I can see why I would get this pitch.
Yeah. Okay. Got you. Lizzy, all right, we talked about what bungs you. You talked about, okay, you're going to help people to send you to a different reporter who is great. We have a little rapid fire question section. Oh, actually, before that, do you ever want to meet with publicists in person to build a relationship?
I have, And yeah, I think it's a high bar. There's just like a lot of, I'm trying to meet with sources who are directly in the places that I want to cover. But I think if you represent clients and that I will need to be interviewing regularly, I am happy to meet with folks. And I think in person is always nice when it's possible.
Ooh, so you do like the in-person. Okay. And speaking of, especially in your field, are you busy on the conference circuit? So is meeting in person at conferences a jam for you?
I don't go to too many conferences.
Okay.
In DC, I'll go to local conferences, but I'm not traveling to conferences as much.
Got you. Okay. Good to know. Yeah. All right. I have my rapid fire section for you. Are you ready, Miss Lizzy?
Mm-hmm.
Okay. First off, phone or video interview?
Phone.
Bullet points or paragraphs in a pitch?
Bullet points.
Short or long pitch? I would imagine short, but you tell us.
Short.
Do you ever want images attached, or do you want a Dropbox zip file or something?
Images attached.
Images attached. Okay. Email or a DM somewhere with a pitch?
Email.
Okay. Email. One follow-up or multiple?
One follow-up.
One and done. Direct or creative subject lines? I would really hope it's direct given the FDA space you're in.
Direct.
Okay. Press release or media kit? Is that ever appropriate?
Press release.
Great. Time that you usually read pitches? I mean, you said you don't really get to read any of them. So there's not a time where you're like, 9 a.m. on the mornings or whatever?
I'd say the morning.
Okay.
That's when I
morning
trying to tame the inbox.
Okay,
yeah.
Great. We talked about sources. That's it, Lizzy. Do you have any last things you want to promote, highlight, tout, blah, blah, blah about you and your fabulous work?
No, I mean, yeah, follow me.
More sirens, by the way. Something really went down over there. Dang, dang, dang.
I'm so sorry.
That's okay. No, it's just right in the background. I kind of like it.
I follow me on Stat. I'm on Twitter, Blue Sky, LinkedIn. Love LinkedIn.
LinkedIn's where it's at. I agree.
It really is. It's great for journalists.
I know.
And just thanks for doing what you do. It's helpful.
We're here.
So
hopefully it's helpful. It's only helpful if people listen to this and then they appropriately pitch you. So please, everyone, please listen. Well, she will meet you in person, but sparingly, it sounds like, because she's not going to any conferences.
I'm going to caveat that. Yeah, like Zoom is fine. It's not, if I'm in the office Wednesday and Thursday, and if you're in the area and if it makes sense, I'm happy to. I like getting a little matcha here and there.
Okay, a little matcha. Okay, good. A little matcha. Okay. We haven't heard of matcha as of late, so that's good. Lizzy Lawrence, she's the FDA reporter at Stat. Get her booked for a matcha if you happen to be in the area. Just to confirm, too, in DC. DC area, where all the regulatory everything happens. Thank you, Lizzy, so much. And since it's the holiday time, happy holidays. Appreciate you so much.
Yeah, happy holidays.